This is Nurse Desi, and I'm back with another video. So y'all, it's been a very long time since I've vlogged, so if you guys are new to my channel, let me go ahead and introduce myself. My name is Destiny. I'm 22 years old. I just graduated from my nursing school in December of last year, and I just passed my NCLEX last month, so I'm officially an RN, and I'm going to be starting my nurse residency program in the ICU at the end of this month. So this video is going to be a preparing for residency, and I'm also going to be taking you guys on my last 2 shifts as a patient care tech. I've been working as a patient care tech at the job that I'm going to be starting at as a nurse for the past 2 years while I've been in nursing school. So I am so happy to be done with being a tech. Like, y'all, like, technically I'm a nurse, but since I'm finishing up my last 2 shifts as a tech, I don't want to bring you guys along because this is a full circle moment. So I'm so excited. And today is February 14th, so happy Valentine's to you guys. This is why I'm wearing my pink scrubs today. So happy Valentine's. If you guys have Valentine's, I hope you guys get shown much love. I hope you guys show yourself love. And I don't have a Valentine, so I'm going to be showing my patients love. So I'm about to go ahead to work, and I've had a lot going on these past couple weeks. So I'm going to update you guys on the way to work and what's been going on. And then I'm going to give you guys what I plan on doing to get prepared for my residency program. So I'll see you guys in the vlog. Okay, you guys, so let me update y'all on what has been going on since I passed my NCLEX. So unfortunately, y'all, my life has been lifing. So a couple weeks after I passed my NCLEX, I was on the way to work and I got into a car accident, y'all. I know. Thank God I was okay. The person was okay. The car has minor damages, so it was not a big deal. But y'all, I've never ever in my life been in a car accident, and like that was one of my worst fears because it's just scary. We're always driving and you never know like if something's gonna happen, and it's just super scary. So I got into a car accident on the way to work, but the car accident, it wasn't bad, so I was still able to make it to work right after the accident. And then y'all, to top things off, so after the car accident, I was going home, and then I went to get my car checked because I just wanted to make sure there was nothing wrong with my car. And then I had it looked at that morning when I got off, and like the mechanic guy was like, oh yeah, like he told me how much it was going to be to fix my bumper. And then he was like, okay, like everything else looks fine. He looked at my tires, he looked at everything on the car, he said it looks fine. So on the second day, I was on the way to work because I had to work again that same night. I was on the way to work, y'all, and then I get off the exit, and why my tire blew, y'all, like the exact same next day as the car accident. I was like, what is going on? Like, y'all, I've never had so much bad stuff happen to me in 1 week. Like, I'm not used to bad things like that happening like stacked on top of each other, y'all. Like, I'm 22, I just got out of college, I just became a nurse. Like, I'm not trying to deal with that, y'all. Like, the devil really be trying. Like, when good things are happening to you, just know, like, as soon as you get to a new level, it's new devils. Like, I just could not. I was calling my mom and I was like screaming. I'm like, Mom, I cannot do this. Like, this adulting is too much. But y'all, let me tell y'all how good God is, right? So thank God the tire blew as I was exiting the exit and not on the interstate, because that would have been very, very bad. But I was getting off the exit, and then I could smell my tire, and I felt my tire just like, I don't know, like I felt like I was driving on the rim, y'all. I was so scared. So there was a sorry about the light, y'all, but there was like a Shell gas station. So I pulled into the gas station, and I was just like freaking out because I'm like, I don't think I'm gonna be able to even drive it to like the tire place. And I do have a spare tire in my trunk, but I was like, I don't know who's gonna put it in. So I was gonna wait on roadside assistance, and I was just like, dang, I'm gonna end up being late for work again, or I'm not gonna be able to make it to work. And like, it sounds crazy because I kept calling my job. Like, the first day I called my job, like, hey, I'm gonna be late, I got into a car accident. And of course they're like, no problem, like, don't even worry about coming in. But I still made it in. Then I had to call my charge nurse again and be like, oh yeah, by the way, my tire blew. Like, it sounds like I'm lying, but y'all, this is really my life. So I was just like, this sounds so bad. But I was so frustrated. But yeah, so I pulled it to the gas station, and I was gonna go up into the gas station. I was gonna talk to the gas station clerk because I wanted to know what their exact address was so that I can call roadside. And then I went in there, and I come out, y'all, and this guy, he pulled up in this like work truck, and he was like, oh, like, do you need some help with your tire? Because he saw my tire was like completely flat. And I was like, first I was a little hesitant, y'all, because I don't trust strangers. And I was in the middle of the city, and that gas station is not like the best area. So I was like, I don't really want no random guy like touching my car or like acting like he's a mechanic. But I was on the phone with my mom, and there was a lot of people in the area, and I was like, you know what, he has a work truck, he looks like he's a mechanic, I'm gonna let him help me, y'all. Why this man, like, he looked at my tire, he's like, oh yeah, your tire just has a nail in it. He literally like patched it up, did everything in his car, fixed my tire. He was so nice. Like, that was a blessing from God, y'all. Like, he did all that in 5 minutes, and I was still able to make it to work on time. So that was like a blessing. And then another blessing, so he fixed my tire, but my mom was like, you still should get the tire looked at, because, you know, of course he's not like a official mechanic, so I just wanted to make sure everything was right with the tire. And then the tire guy, so I took my car to like this little tire shop, and then he was like, yeah, I see he patched it, but he was like, I would still suggest getting a new tire, because like you don't want to risk like your tire blowing again and all this other stuff. So I was like, okay. So I'm thinking I'm gonna have to pay for a whole nother tire. And I was just telling him like, look, I've been going through it, and like on all these days, like I was dressed in my scrubs, so I don't know if being a nurse helped it or people were just in a very nice mood. I don't know. But I was just sitting up there like, y'all, like, I really need some help. So he was like, you know what, I'm just gonna go ahead and change your tire. So I was like, okay. Sorry, y'all. But yeah, I was like, okay. So he changes my tire, and then I was like, okay, how much is that gonna be? And he was like, I took care of it, it's free. I was like, you gave me a free tire and put it on for free, y'all. Like, I was literally about to start crying in the tire shop, because that is so nice. And like, God was really, really blessing me, because after all that bad stuff, y'all, I was really about to have a whole mental breakdown. And like, y'all, like, this month is already a very difficult month for me, because if you don't know, my father passed away on February 16th of 2021, and then my grandfather passed away on February 1st. So this month is already like a very just emotional month for me. So I already be mentally going through it, and then you got to go through all this extra life stuff. It just doesn't make stuff better. So I just want to give y'all an update on why I have not been vlogging, y'all. I have been fighting for my life. Like, it has been very difficult. So I had to get my mental back together, but I am good now, y'all. So we are back with the vlogs. I did have a lot of stuff planned for you guys, and I want to get some videos out before I start in my residency program, because y'all, I did officially get my schedule, and I got my preceptor. And this program, if y'all are thinking about doing a residency, just know the first couple months you're going to be busy with orientation, with classes, with shifts, 12 hours. It's going to be a lot. But I feel better just because I know my job and I know the people. So I feel confident. And I actually, like, I don't know if it's just because I've been so busy with all this other stuff in my life, but I haven't had too much time to get nervous or feel very, like, scared about starting. I actually feel pretty confident, so I really think I'm gonna be fine. Like, all my charge nurses and all the nurses on my unit are like, you're gonna be perfectly fine. And ever since I became a nurse, y'all, I've been being so involved. Like, anytime there's a patient that's coding, or if there's like a patient that's declining, I'm always in the room. I'm always learning stuff. And since I am a nurse now, I'm able to do more things. I'm able to really help my unit. So I've really been acting more as like a resource nurse than a tech. So I really felt super involved, and everybody's like, you know, like helping me, teaching me how to work the CRT machine, how to work the ventilator, like just like seeing things going on with your patient so that I can be just experienced when I start. So I feel so grateful and thankful for that. It says tomorrow is my last shift as a tech, and it's my last shift on night shift for a very long time. And I love my night shift crew, y'all. I can't wait to go back to them. I am going to be nights, but I have to do my first 2 to 3 months on day shift. So it's going to be a long time till I work night shift. So I want to bring them a gift or just some treats or something tomorrow, just to show my appreciation for my unit. So I'm probably going to stop and get like some donuts or something tomorrow, but I'll figure that out. But yeah, so I also have been doing my modules, because I did tell you guys, I think I told you guys in my last vlog, but my manager did allow me to start doing my echo modules, and echo is like essentials of critical care. And y'all, that is over 100 and something hours in modules, but it's very, very good information. And if you guys do it, I highly suggest taking notes, because you can't go back into the modules once you finish it. So you really want to like get as much information as you need out of it. So I've been taking a lot of notes on my modules, and I finished cardiac so far, I finished renal, I finished hemodynamics, and I'm starting on pulmonary. So I got a good bulk of it done. So I feel really, really good about that, because just seeing how busy my schedule is, I'm not gonna have as much time to do the modules on my off days, because I rarely even have off days, y'all. Like, it's a lot. So I'm definitely gonna be vlogging when I start. But this week, so I told y'all I worked these next 2 days, and then this weekend I plan on buying some more scrubs, because at my job we have to wear navy blue. That's kind of a universal color for most nurses, so I don't have any navy blue scrubs. I'm gonna order some on Figs and some websites, but until those come in, I just want to go to this scrub outlet that's by my house that I get all my like tech scrubs at. I want to get some more of those. And then I'm gonna just start building up my stash. I'll probably get like 3 to start off with, and then order the rest online. And honestly, I'm not gonna get like a whole bunch of like scrub tops either, because we typically wear like t-shirts, and you know, so I'm gonna get probably like 3 full scrubs, and then get pants and just stuff like that. So I'll show y'all when I do that this weekend. And then also, my job is hosting a meet and greet before we start our residency program, and it's actually at a restaurant, so I'm super excited about that. That's next Monday. So I may just keep this vlog going, because I'm starting on a Wednesday. I may keep this vlog going to that day so that y'all can see me meeting with my people. I'm probably not going to put them on camera because I don't know them yet, but like, I'll try to get a couple clips for you guys on how it goes. I'm so excited, because most jobs don't host like a meet and greet before you start. So I'm really excited that they're doing this. It's like at a Mexican restaurant, so it gives us a chance to break the ice, since we are going to be with these people for a whole year. So it's good to get to know each other and stuff like that. So I'm super excited about that. I'm probably going to find a cute little outfit to wear for that. And yeah, so I'm just going to be like going to Walmart to pick up like a binder and stuff like that, because I am going to have quite a few classes. So far they have me enrolled in CRT class, I have like a cardiac class, I have a central line class to practice dressings and to learn about all the complications with central line. So I have quite a few classes, like a hemodynamics class. Yeah, it's a lot. That's all just in March, so I don't even know what is gonna be the next month, but on top of all the orientations and stuff like that. So my first official day will be February 26th. Of course I will vlog for you guys, but this week will just be getting my supplies. I'm not gonna go crazy with all the ordering stuff, because I still have so much stuff that I still use. Like, I have a clipboard from nursing school, I got a whole bunch of badge reels, I got all the little cute, you know, essentials for nursing school. So I really don't know like what else to buy, because I don't really need anything. Like, I'm just gonna bring myself and my brain. Like, that's all I really need to work in the ICU. So I'm probably not gonna go crazy with all the Amazon orders, but if I do see something cute that I want to buy, I'll show you guys. But I know this has been a long intro, but I'm on the way to work. I will talk to you later. If I see something crazy at work, I'll let y'all know. Alright guys, so it is 9 o'clock. All my patients are good, and I'm on the way to Panera, because y'all, I have a bad habit of meal prepping all my lunch and then buying food. Like, it doesn't make sense, but I'm hungry, so I'm gonna get some Panera. I ordered a pizza and I'm just gonna pick it up. So I'll take out to Panera. My hospital has a Panera and a Starbucks, so that really works. And the Panera is in the new side of the building. My unit is on the old side of the building, so it's much nicer over here. But I was starving. I didn't eat anything today, and I was supposed to stop and get some food, but I was running late to work, so I'm about to eat some Panera. Good morning, you guys. So today is February 15th. I just got off of my night shift, and y'all, it was a great shift. Like, patients was behaving. Everything went smoothly. I was able to help the nurses do a lot because it was just a really chill shift. So I learned a lot, and I was actually able to get a lot of modules done on my downtime. So that's good. And tonight, y'all, is my last night as a tech. I'm so freaking excited, y'all. Like, you will never understand. Like, it ain't nothing against being a tech. I actually really enjoy being a tech, and I felt like this was the perfect job, like, to have in nursing school. Like, honestly, I wouldn't have probably made it and been able to graduate with a 4.0 if I didn't have this job. Like, great staff. It was so chill, like, learned so much. Like, it was literally just like the best job to have as a tech, and I got so much learning experience to prepare myself to be a nurse, and was able to secure a job straight out of nursing school. So I'm so happy to be a tech, and I honestly do believe that it's really beneficial for anybody that's becoming a nurse to be a CNA, a patient care tech, like anything involving direct patient care. I am 100% like, I feel like it should be a mandatory thing, because you have to master that patient care before you can go in and just start being somebody's nurse. Like, you gotta learn the basics, like just taking care of people, doing their daily care. Like, everything is very important to learn how to be a good nurse. So since I feel like I've completely mastered that aspect of it, I feel like I'm gonna be such a good nurse. Like, I'm so happy. I'm just so excited. Like, I just learned so much in this job. So I'm grateful to God to be able to have this job as a tech. But I am so excited for the next chapter, and to just finally officially start my big girl career job. Like, I'm so excited, y'all. And y'all know the plan. And, you know, being an ICU nurse is going to open up the doors that I need to get to the next level. So I love the ICU. I already love my crew. I love the people I work with, and I love my patients. So it's going to be so exciting to be able to finally put to test all the things that I've learned, because I always tell people, like, watching and observing things is nothing compared to doing it. Like, yes, it does help you understand some stuff, and it helps you get some exposure, but I'm not gonna be staring at the other nurses doing everything. Like, I'm the nurse now, so I can't just be zoned out and just in a whole different world when stuff is going on. I have to be zoned and clocked in at all times, because this is my license, this is my patient. I can't be playing games. So it's officially real, and I know that I have to start taking that initiative. So like, anytime I'm getting admissions, I'm the one jumping in. I'm the one trying to, like, do the whole admission, set the patient up, put the EKG leads on, put the pulse ox on, just do everything so that I know what to do when I'm getting an admission and when I'm getting a patient, and, like, what are all the steps that I need to take. So I highly suggest that for all my upcoming nurses, like, get that experience. And even if you don't have, like, tech experience, or if you can't juggle working and being in nursing school, take full advantage of your clinicals. Don't be the type of nursing student that's just standing in the back when things are going down. Like, try your best to be hands-on and involved. Like, even if you don't have the best preceptor or the best nurse or whatever, still be like, anything that you can do, take initiative, like, period. So I will see y'all after I wake up to come to my last shift. So I'll talk to y'all later. Hey, you guys. So today is February 15th. It is my last shift as your patient care tech. And y'all, like, today I woke up sick to my stomach. I was so nauseous. Like, I don't know if it's because I didn't, like, go straight to sleep. Because for some reason, I don't know why I couldn't sleep when I first came home. I had so much energy, but I regret it, because now I don't feel like I got enough sleep, and I woke up feeling sick, and I was, like, so close to calling out, but I'm like, I can't call out on my last shift. So I got up, got ready, and I feel a little bit better. So I ordered some Chipotle since it's my last day. I wanted to get some good food, so I got Chipotle, and then I have to go pick up a package that my aunt sent me. So I'm gonna go to FedEx, pick up the package, and then I'm gonna head to my last shift. So y'all, I love my little ICU nurse shirt, y'all. Like, I gotta get some more of these. These are so freaking cute. I got this on Amazon, but got my coffee, about to go pick up my food, and I will talk to y'all later. picked up my package, and look what my aunt got me. She got me some new Crocs, and they're navy to match my navy scrub, so that's good. Because y'all know, like, I was just telling somebody at work, but every time I wear Crocs, like, I'm gonna have a chill night because I'm not gonna work too hard in my Crocs. But Crocs are so comfortable. Like, I don't care what nobody say. Like, I'm not no tennis shoe girly. Like, I don't like the big hokas and hookahs or whatever they're called. Like, I gotta find some shoes that are good for me because I have like very sensitive feet. Like, a lot of shoes do not feel comfortable on my feet, so I really gotta find something that's like good for me. But I've tried a lot of those shoes that everybody be swearing by, and they're just too big and heavy to me. I don't know, but my Crocs will never fail me, so I'm so excited. Those are gonna look so cute with my scrubs. So I'm gonna definitely be wearing my Crocs on the first day, and they got the fur with them, so yeah, I'm definitely wearing my Crocs. So that's exciting. Thank you, auntie. But yeah, I'm running to work now. I'm kind of running late because I had to like stop and get this package, but I didn't want it to be sitting too long, so I'll make it to work. It's my last day, so like they better be happy I'm even coming because I was not feeling it when I first woke up. But y'all, like, I've been making my own coffee at home, and that was probably the best investment I've ever did. Just buy you some coffee, and like, I'm an iced coffee girly, so I don't even have to be putting everything in the espresso machine and everything. All I need is some ice, some coffee, and some creamer. Like, that's all I need. So that has been saving me so much money and time, not having to stop at, you know, all these coffee places and spending $5 every day. So if you're trying to save some money, try to make your coffee at home. But I'm about to hop on this interstate, head to work, and I will talk to you later. So it's already 9 o'clock on my last shift as a tech, and today is going great. Like, everyone is like hugging me, like, I'm gonna miss you, because y'all know I have to move to day shift. So I won't be working with all my night shift besties, so I'm gonna miss them so much. But I'll be back in about mid-May. I'll be back on night shift, but I was just kind of hugging everybody, and then me and one of my nurse besties, we were cleaning up her patient, and we lost the IV. And y'all know in the ICU, every patient needs at least 2 to 3 IVs or a central line or something, because there's a lot of meds going. So we lost the IV, and she was like, do you want to try to get an IV? And I'm like, yes. So y'all, I got an IV on a hard stick, because y'all know a patient in ICU, he's intubated. He's really sick, so it's hard to get IVs on them with all the edema, and there's just a lot going on. So got an IV, and I also got his labs, so I was able to stick him and get his labs, and then got an IV. So I felt really good about that. And I've just been learning a lot, and I'm about to help her transfer one of our other patients to the floor. But I stopped to go get a drink from Panera, so I'm about to go grab that because I ordered it online. So I'm gonna get my drink, and then we're gonna go transfer her patient out and then get ready for a new admission. So tonight is going great. Oh, and I forgot to tell y'all, I also got an email from my manager, and she sent me a super nice email, and she was just like, I'm so happy for you and your success. And she said, I'm doing great on my echo modules, because I told y'all I've been knocking the modules out. Like, I finished a lot so far, almost half of the modules. So I've been doing great, and she said I'm setting myself up for success, because like, some people take so long to do the modules, but since you're learning so much in the modules, it's really good to have like some pre-knowledge on that stuff, so that when you see it going on with your patient, you'll have an idea of like what's going on. So I've been really paying attention to the modules, taking notes, and I think I'm doing really good, y'all. I'm feeling like a nurse. Like, my nurse, Desi, is finally coming out, because I noticed one thing that's really hard about being a tech for so long is that sometimes you get like imposter syndrome. It's like you don't feel like you're the nurse. Like, it just doesn't feel real to you because you've been in that tech role for so long. So I'm finally starting to feel like I'm a nurse, like I'm really the nurse. So it's a good feeling, y'all. I'm just so excited. So I'm about to go pick up my drink, and I'll talk to y'all later. Hey y'all, so I am on my break, y'all. I'm enjoying like probably one of my last real breaks, so I can like go in the break room and get a blanket and relax. I'm probably not gonna ever be able to do this again, because y'all know the patients be so critical that we have to like sit out there and eat our lunch, because can't walk off the unit that long. But I'm enjoying my break. But y'all, I forgot to update y'all on what happened when I said I was transferring that patient out, y'all. Drama. Like, when I tell y'all, like, I want to hear y'all opinion on this, because So I started out, like my first hospital job was at the job I'm at right now. So I started out in the ICU, and then even in my practicum I was in the ICU. So maybe I'm a little biased, so my opinion may be biased, but I'm very used to critical patients, so I really don't be knowing how it feels being like a floor nurse, because our patients are not stable at all. Like, they're all critical, so we always have that, I don't know, like things that are abnormal for floor nurses are normal for us. So with that being said, we were transferring a patient out. The patient was like, blood pressure was on the softer side, but mind you, this patient's blood pressure has been like that the whole time they've been on our unit, and his MAP was still above 65. He was responsive, he was fully with it. And when we're transferring patients, their heart rate tends to go up a little bit too when we're moving around and stuff, because we have to pull the patient from the ICU bed to the floor bed, and that's a lot of movement and everything. So the patient heart rate was a little bit tacky, like in the 110s, right? But that's also been normal for this patient. So we get down to the floor to transfer the patient, and we pull the patient into the room, and we always have our patient on transport monitors. As soon as we get down there, the nurse, and she was sweet, so there's nothing against her, but the nurse was like, oh no ma'am, like I cannot take this patient is too sick. And like she was like, I am not taking this patient. And I totally understand like what she's thinking, because when you first look at those vitals and you see like a patient's blood pressure is like 90 over something, heart rate 110, like it may seem abnormal, but if you would have looked at his chart and see all the vitals and see that that's how he's been trending the whole time, like that's kind of critical thinking that we think in ICU. Like we can't just take one set of vital signs and come up with the whole story about one set of vital signs. Like you have to see how a patient is trending, right? And then also the patient had an order for fluids and all this other stuff. So like you could easily get some fluids and, you know, started that too. But we're like, wait, what's going on? And she's like, I'm about to call a rapid response. And we're like, wait, what? Like we are two ICU nurses in the room. Why are you calling a rapid response when we're in the room and this patient is stable, y'all? MAP above 65, fully responsive, answering our questions. What are you talking about? So we're like, wait, what? And she's like, I'm calling my charge nurse because this patient is not stable. And the charge nurse was like, call the rapid. And then so we call our charge nurse because we're like, wait, what? And our charge was like, the patient is fine. Like that's been his vital signs the whole time. Sorry, I got interrupted. But yeah, so I was just like, why would you be calling a rapid response? So we was telling her like, do you want us to give him a bolus of fluids? Do you want us to start some fluids on him and just stay here and monitor? Like, we have no issue with doing that. And she's like, no. So we had to have our charge come talk to her and be like, you have to take this patient. Because the thing about the ICU is that we have to have open beds. Like when our patients are stable enough to be transferred out, we got to get them out as soon as possible, because any patient that colds on the floor, any patient that comes in the ER that is critical, any patient that is something's going on in L&D or anything, we get those patients. So if we don't have any rooms, we can't take our very critical patients. And like, I understand if his blood pressure did not go up with some fluids, or if he was like unresponsive, or if his blood pressure went from like 130s and then it dropped down to 80 over something, and then heart rate shot up to 150s or something, yes, we are very concerned. But we're not concerned about a MAP over 65 and a patient that has some fluids going that's going to shoot right back up. Oh, and the patient was asleep too. Like he had just woke up from being asleep. So your pressure also goes down when you're asleep. So I don't know what was going on, but she gave us a run for our money. But like we asked her if we wanted her to, like if she wanted us to stay and start the fluids, and she was just like, no, like I'll do it. Y'all, patient was fine, but we had to hurry up because we were getting another admission that was in DIC that was very critically hemorrhaging. So when stuff like that is happening, we have to go to like critical patients. And this patient been on our unit for weeks. The patient is stable. So, but I don't know, I want to hear y'all opinion, because I'm sure it probably looks concerning to a nurse that has not had a critical patient on your unit. So maybe it's very alarming to see your patient's heart rate at 110 and 80 or something. But I still feel like floor nurses should still look at your chart and see what this patient's vitals have been trending and been like, okay, this patient have always been hypotensive, and they have orders to give him fluids, they have orders to give him multiple things that can get his blood pressure back up. So I don't know, but y'all let me know how y'all feel about that. But yeah, so that was a good experience to see how transferring patients could also cause you a lot of issues. But besides that, it's calmed down. I'm about to go back to my patients. I've been on break for 30 minutes. I'm about to go back. Ate my Chipotle, y'all. It was so good. So I will talk to y'all at the end of my shift, my last shift. Hey y'all, it is Saturday, February 17th, and I did not come back to y'all after my last shift, but it's because I had came home, took a little nap, and then I actually went out with my sisters and we got crab legs. So that's why I didn't come back to y'all. But today's Saturday. I told y'all that I was gonna go look for scrubs today, but last night, y'all, I ended up going on Figs and I just ordered like all the scrubs that I want. I fell into the Figs hype, y'all. Like, I know everybody be like, Figs are too expensive, it's overrated, but y'all, I really like their quality. And I feel like when you wear Figs, like, it feels so much better than when you wear them other scrubs. Like, I've seen how the Figs quality is versus like cheaper scrubs that I've gotten like at the places around where I live at, and I just don't like the quality. I feel like it's worth paying a little bit more to get high quality scrubs that also look really cute. Like, who don't want to look cute and have good quality scrubs? So I decided to go ahead and order 2 sets of scrubs so far, and I'm gonna get some more, but I got like ones that have different scrub like top styles, so I'll show y'all that when they come. And then I got like the high-waisted pants, so I'm gonna probably do a little try-on haul or just show y'all next vlog. I decided to go ahead and split up these vlogs into 2 because I said I was gonna vlog next week. I was gonna combine these vlogs, but since I already have a good amount of footage, I'm gonna end the vlog today and then start a new vlog tomorrow to show y'all what other things that I'll be doing to prepare for residency. But today I'm gonna go ahead and look for nurse shoes, because I think I told y'all earlier in the vlog that I really don't like tennis shoes, but like I need to find a good nurse shoe. Like, I have to do what I gotta do because I can't wear Crocs every day, and I need something that's gonna be supportive. So that's what I'm gonna go look at. I'm thinking about getting like the On Cloud, because I told you I don't like the hookahs or whatever they're called. I don't like those. They're just too bulky. So I'm gonna go try on some shoes today, see what I can find. And then I'm also going to the mall to just find an outfit because I'm going out to meet my my group, like my residency group. My job is having a meet and greet prior to when we start next Monday, and I want to find a cute little outfit because I want to meet everybody. I want to be cute, so that's what I'm gonna do right now. And I also gotta get my eyebrows done and everything. Like, to me, I feel like the residency, preparing for residency is just maintenance, because if I look good, then I'm gonna do good. If I feel good about myself, like, I want to make sure my hair is done, I look good, I got nice clean fitted scrubs on, I got a nice bag. Like, as long as I have all the materials that I need and I feel confident, I feel like I'm gonna do good in residency. So next week is when I'm gonna pretty much be getting my scrubs, and then I'm gonna show y'all some other things that I'll be getting. But I'll take y'all with me today so we can go get these shoes and see what we're gonna get into today. So let's see. See, my days are cold without you, but I'm hurting while I'm with you. And though my heart can't take no more, I keep on running back to you. See, my days are cold without you, but I'm hurting while I'm with you. And though my heart can't take no more, I keep on running back to you. Baby, I don't know why you're treating me so bad. You said you love me, don't wanna find me, and I was all you had. And all my heart is beating for you, I can't stop crying. I don't know how I allow you to treat me this way, and still I stay. See, my days are cold without you. Hey y'all, so I have not came back and talked to y'all all day, y'all. It's like 5 p.m. but today has been a success. Like, I literally found everything that I needed. I went to this shoe store and I saw these really cute shoes, and then I ended up leaving that store and I went to Dick's Sporting Goods because I wanted to see if the On Clouds were going to be better than the shoes that I found. And the on clouds, y'all, I love how the on clouds feel. They fit perfectly. They look so cute. So I decided to go with the on clouds. And y'all, I promise I was not trying to go into there and get a freaking Stanley. I did not want to be the aesthetic nurse. Y'all gonna be judging me, but I just like the Stanley. I needed to get it. I saw it when I was about to check out and I got it. So hey y'all, so I'm back at the house. I didn't finish that clip when I was in the car. My sisters had came in and they were trying to talk, but I was telling y'all I did not want to be the aesthetic girly, because y'all know how TikTok be. Everyone's like, oh, people are going into nursing for the aesthetic and they don't really care about patients. And I really hate that narrative. Like, I feel like it's so false. Like, not to say that there isn't people that don't go into nursing for the money, but me personally, like, I feel like that does not apply to me, because I've always been so passionate about patient care and taking care of my patients. And then if I was to go into nursing for the money or for the aesthetic, I wouldn't have chose the ICU, the hardest place to start out as a new grad, if I just wanted to go in for the aesthetic. But I'm not even gonna get into that topic because it irritates me. But I was telling somebody at my job that, like, I feel like people judge you when you're just one of those nurses that just want to come into work and you want to be pretty and you want to have your hair done and you want to have nice scrubs. Like, I just feel like the amount of work that we get, with the amount of things that we go through as a nurse and the trauma that we see and the amount of work that we have to do as a nurse, if doing small things like getting a Stanley or getting figs or just wanting to be cute, wanting to have your hair done, if those things make you happy, why is that a problem? Like, why should it be an issue if I just want to look good? And maybe that just helps me get through my shift knowing that I feel good about myself. Like, I don't get that whole narrative. But like I was saying, I literally was checking out at Dick's and I was getting my shoes. I want to actually show y'all my on clouds. But I was getting my shoes, and then I was walking by the little checkout, and they had a whole thing full of Stanleys, y'all. And y'all know I have a Stanley dupe. It's actually over here, y'all. So I have a Stanley dupe I got off Amazon, and I love my Stanley dupe. Like, I never cared about really having a Stanley because my Stanley dupe has been getting me by just fine. But I saw this whole group of Stanleys, and I saw a 30-ounce Stanley instead of the 40-ounce, because mine is 40, and this thing is huge, y'all. Like, this thing is super big, and the 30-ounce was so cute. And I was like, y'all, the color is like light pink. If y'all know, pink is my favorite color. So y'all, I'm gonna show y'all the Stanley, and it looks like the same color, but it's actually a lighter pink. I don't know if y'all can tell. Let me have the camera focus. But this is the 31, so let me show you the comparison. Like, see how big this is? I prefer a smaller cup, y'all. I think I'm gonna like this a little bit better, because I be coming into work, I be having my iced coffee in this big cup. It just be a lot. So, but I'm still gonna drink out of both of these, but I don't normally even finish a whole 40-ounce thing like this. I feel like this is a little bit more, it's a little bit, it fits my vibe a little bit more. So I really do like the Stanley, y'all. So I am happy to be in the Stanley group. But let me show y'all the shoes. The shoes is the main thing. These on clouds are so comfortable, y'all. So this is my first nurse shoe. It really gives like workout shoe, but that was the vibe I was giving, because like I didn't really want, like I told you, I didn't want the hookahs or the hokas. I didn't want all them other shoes. I just wanted something that was going to be like an everyday shoe that I could wear other places too and still wear to work. And I like these. They're black and white. I feel like they'll look fine with my navy scrubs. And I had saw some other ones that were white, and they did look super cute, but y'all know the hospital is just, it's gross. White shoes get dirty so fast, and I know black is not going to get dirty. They like conform to my feet shape, because I have wide feet. I told you my feet are just, it's hard for me to find shoes. I have wide feet. So as soon as I put my foot in this, I was like, yeah. So I'm gonna tell y'all how they hold up on a 12-hour shift, because I haven't worked in them yet, but let's just pray that they feel good. But after that, I told y'all I was looking for an outfit to go to my meet and greet, and I found a cute little outfit at Windsor. Went to Windsor, and I literally just got some leather pants. Y'all, these are so cute. I'm gonna probably do a try on haul when I get. But I got these tan leather pants. So cute. Y'all, on, they are so freaking cute. With some boots. These are gonna be fire. And then I got this turtleneck, and it's like a bodysuit. So it's a turtleneck, but then goes down. And it just looks so cute together. Like the turtleneck is all tight, and then the leather pants. So that's what I'm gonna be wearing to my meet and greet, but that's gonna be on Monday. And I'm gonna go ahead and end this vlog today. And yeah, I've been getting a lot of messages about doing a study video, and y'all, the study video is coming. I'm gonna upload this vlog first, and then the study video is gonna be the very next vlog. So I mean the very next video that I upload. So study video is coming very soon. Put in the comments, because I think I'm gonna break it up by each classes that I took, because the studying does kind of change depending on what classes you're taking. So I was going to talk about like how I study for health assessment, how I study for med surg 1 or adult 1, or how I study for critical care, how I study for like mental health, because I know everybody like has a different method. So I wanted to kind of break it up. If y'all like that, or do y'all just want to give like broad study tips of like how I study in nursing school, period? Because some of it does overlap, but then certain classes I did specific things. So just let me know like what specific things y'all want. I am going to talk about like the breakdown. Like I was going to get very specific, so it's probably going to be a long video, because I don't want to just be vague. Like I don't want to just be like, oh yeah, in order to be successful, have good time management. Like that's not really gonna help. I was trying to give y'all specific things that I did to get a 4.0 in nursing school. So I want to help my girlies out, y'all. I know nursing school is hard, and I don't mind answering y'all questions. Like if y'all have to DM me, if y'all have like specific things going on, because I know y'all ask me, like some people are having a hard time in school, or you failed a class. If you need any advice, like don't hesitate to reach out to me. I will definitely get back with you. DM me at Envydezi. And then I also wanted to thank you guys, y'all. We hit 1,000 subscribers. We're actually at, I think, like 1,100 subscribers right now. And thank you so much, y'all. Y'all have been loving the NCLEX videos. Y'all been showing so much love. Thank y'all for supporting me, y'all. And the new journey is just beginning. When I tell y'all this is just the beginning, it's just the beginning. So thank y'all for showing so much love, and I will see you in the next video. Bye.